Hi, I'm Brandi Randolph, and I am here to discuss the Affordable Care Act and ways that it can be approved here today at Congress. So, as you know, the Affordable Care Act was enacted in 2010, so it has been around for almost 8 years. This was a health care reform to help provide care to Americans that weren't able to receive it before. The whole goal of this was to just allow more people to have access to health care. So, in our book by J. Showalter, it expands care to the U.S. citizens in the healthcare delivery system. So, basically, we are just trying to provide lower health care costs to people so they're able to afford the care that they need. Um, in an article by researchers Fitzgerald and Gurley Calvez titled The Affordable Care Act and Consumer Wellbeing, the Knowns and Unknowns, it says that the Affordable Care Act had three primary goals. The first was a dual goal of improving the quality of health care by lowering costs, increasing the access to health care, and providing a greater consumer protection in health care. So, with the healthcare advance, we wanted to make sure that by implementing the Affordable Care Act, that everyone would be able to receive coverage regardless of whether there was cost factors associated with it or anything like that that had been a determinant previously. So, since the Affordable Care Act has been implemented, there was an article that was posted by the Harvard Business Review that was written by John Toussaint called Improve the Affordable Care Act, Don't Repeal It. Because, of course, with implementing an act, you may in the future have to amend some of its laws and regulations. So, with this, there was found that in a study between 2013 and 2015, that 22.8 million people had gained coverage while 5.9 million people lost it. And that resulted into a net increase of 16.9 million people with insurance coverage. And it also helped the amount of uninsured Americans fall from 42.7 million to only 25.8 million. So, there's still a little bit that do not have coverage. However, it's definitely improved the amount of coverage for almost 20 million people to receive healthcare services now, which is outstanding. It was also found that in a research article called Trends in Health Insurance Enrollment by Catherine Carmen, Christine Eibner, and Suzanne Paddock, that the analysis between September 2013 and February 2015, 22.8 million people became newly insured. So these are people who have not had health care services before, had not been covered with the Affordable Care Act. They had been covered. Yes, some people did lose their coverage, so that was unfortunate, but it did allow more people to gain access to health care. So, with the Affordable Care Act, it has made such a huge impact on our nation. One of the reasons I'm here to talk to you today is because there is a few things that can be modified. So, according to our textbook by J. Showalter, there was a part that said that individuals have to obtain coverage or pay a penalty or fine. So, what that means is that if you do not have health care insurance previously through a company or seeking your own private insurance, or you do not enroll in the Affordable Care Act, that you can be penalized or fined for not having any health care coverage. So, in my opinion, from everything that I have seen by working within the healthcare industry, I think that people should not be fined for not obtaining healthcare coverage. The reason I say this is because, yes, we do want to expand healthcare services to as many Americans as possible. However, I have found that there are many people who do not utilize healthcare services like they should. I have seen many people working in my profession that don't go to the doctor that much, do not seek medical services that much. And as much as we try to emphasize taking care of your health, using and utilizing preventative services, some people just don't use them. And that's just because they made that decision that they really don't go, or they don't get sick often. So in my opinion, if an employee wants to opt out of healthcare coverage, or if they don't just want to seek any medical treatment, I do not feel that Americans should be fined for choosing to not go that route. I think that with the Affordable Care Act, it should be an option on whether you want to receive healthcare coverage at an affordable price, which is great. That's what we're trying to promote for our citizens. But if a person just doesn't feel like they are really in need of medical attention and opt to just not enroll, I don't feel like they should be penalized to pay a huge fine for that. And I think that that's definitely something we can improve on with the Affordable Care Act. Along with that, I think that it would be in the best interest to make sure that with the Affordable Care Act that services are actually being affordable. That's the second thing I want to highlight here today. I have seen that, yeah, it does get kind of pricey, and we are trying to provide services to people at lower costs. So I feel that, yeah, the healthcare premium should not be as as high as they are for people enrolled in the Affordable Care Act. Just like in the name affordable, it should be affordable. I think that by doing this, the amount that we saw, where there's still almost 20 million people who don't have that coverage, I feel like they would probably elect into it more if they were able to have that coverage, that it was more convenient and they were able to meet the premiums each month compared to what the premiums are set at now. I know this act hasn't been enacted that long. It's been going on 8 years. So I do hope that for in the future we can look at some of these modifications and really see that we need to promote the health and well-being of citizens over just adding more money to healthcare services and attaining revenue. Now, I know the whole primary point of a business is to grow, to meet certain profit amounts each month and so forth, but I really do feel that the Affordable Care Act is a great thing and it can do great things. Along with that, I think that we should take a step back from being in, the political and administrative part of healthcare and really look at what's going to benefit our citizens, which in my instance, for what I believe would be best, would be not penalizing people who opt to get out of it. At least it's being offered. It's responsibly their own choice to decide whether or not they want to seek health care. And if they don't, then so be it. That's their own personal choice. And lastly, I think that the other thing should be making the healthcare premiums more affordable. I think if we can lower that standard that everybody has to meet as far as the minimum, if we lowered that down, reduce some of those healthcare costs even more, that we would have even more Americans with healthcare coverage. So again, my name is Brandi Randolph. This was about the Affordable Care Act, just a few recommendations as far as what I think could be modified, and I hope you take this into consideration. Thank you. Have a great day.